Welcome to my channel Medicine Guide. Narcan. Saving lives in crisis. The power of Narcan. Narcan's active ingredient is naloxone hydrochloride. It is an opioid receptor antagonist, which means it can quickly reverse the effects of opioid overdose by binding to the same receptors that opioids bind to, thereby displacing the opioids and reversing their effects. In this video we will discuss about the power of Narcan or its benefits, routes of administration, adverse effects, allergies. So let's start our discussion. Benefits of Narcan, naloxone. But before we start, please subscribe to my channel Medicine Guide. Now let's start with benefits of Narcan. 1. Rapid opioid overdose reversal. The primary and most significant benefit of Narcan is its ability to rapidly reverse the effects of opioid overdose. It can quickly counteract the depressant effects of opioids on the central nervous system, including slowed breathing and loss of consciousness. This can be life-saving in situations where an individual has overdosed on opioids. 2. Increased survival rates. Narcan administration can significantly increase the chances of survival for individuals experiencing opioid overdoses. By quickly restoring normal breathing and consciousness, Narcan helps prevent fatal outcomes. 3. Ease of use. Narcan is available in easy-to-use forms, such as nasal sprays, that can be administered by laypersons, first responders, or family members without medical training. This ease of use increases the likelihood of timely administration during an overdose emergency. 4. Reduced harm. Narcan not only saves lives but also reduces the potential harm associated with opioid overdose. It can prevent brain damage, organ failure, and other severe consequences of prolonged oxygen deprivation due to opioid overdose. 5. Public health tool. The widespread distribution of Narcan to individuals at risk of opioid overdose and their close contacts has been promoted as a public health strategy. This approach, often called harm reduction, empowers communities to respond effectively to overdose emergencies and reduces the stigma around opioid use disorders. 6. Safety net for pain management. Narcan can provide an additional layer of safety in pain management, especially when opioids are prescribed. This is important because accidental overdoses can occur due to various factors, including dose miscalculation, medication interactions, and patient variability. 7. Emergency medical services. Narcan is a crucial tool for emergency medical services, EMS, and hospital settings. It allows medical professionals to stabilize patients quickly, providing a window of opportunity for further medical interventions and comprehensive care. 8. Educational opportunities. The availability and use of Narcan have spurred educational campaigns about opioid overdose prevention and response. These campaigns raise awareness about the signs of overdose, the importance of seeking medical help, and the proper use of Narcan. 9. Naloxone access laws. Many jurisdictions have implemented laws and policies to increase access to Narcan. These laws allow pharmacies to dispense Narcan without a prescription and protect individuals from legal liabilities when administering Narcan in good faith to help someone experiencing an overdose. 10. Support for opioid use disorder treatment. While Narcan addresses the immediate emergency of overdose, it can also serve as a bridge to connect individuals with opioid use disorder to treatment and recovery resources, as surviving an overdose can be a powerful motivator for seeking help. Overall, Narcan plays a vital role in addressing the opioid crisis by saving lives, preventing long-term harm, and providing a safety net for individuals at risk of opioid overdose. Its availability and use contribute to a comprehensive approach to tackling the opioid epidemic from both a medical and public health perspective. Administration routes. Narcan can be administered through various routes depending on the situation. 1. Intranasal. Narcan is available as a nasal spray, which is sprayed into one nostril while the person is lying on their back. This route is particularly useful for bystanders or first responders who may not have medical training. 2. Intramuscular. It can also be administered as an intramuscular injection into the thigh, shoulder, or buttocks. This route is common in medical settings. 3. Intravenous. In a hospital setting, naloxone can be administered directly into a vein, intravenously, for rapid and effective reversal of opioid overdose. Adverse effects. Narcan is generally safe and well tolerated, especially considering the potential life-saving benefits. However, like any medication, it can have some adverse effects. 1. Withdrawal symptoms. When Narcan is administered to someone who is physically dependent on opioids, it can lead to rapid onset of withdrawal symptoms. These symptoms can include restlessness, sweating, nausea, vomiting, increased heart rate, and agitation. 2. Agitation. In some cases, the reversal of opioids can lead to agitation, confusion, and aggressive behavior. 3. Increased blood pressure and heart rate. Narcan administration can result in a sudden increase in blood pressure and heart rate, which can be concerning in individuals with certain pre-existing conditions. 4. Nausea and vomiting. Some people may experience nausea and vomiting after receiving Narcan. 5. Pulmonary edema. Although rare, Narcan use has been associated with the development of pulmonary edema, a condition where fluid accumulates in the lungs. Allergy. Allergic reactions to Narcan are extremely rare. However, as with any medication, it is possible for someone to have an allergic reaction. Signs of an allergic reaction might include rash, itching, swelling, especially of the face, lips, or throat, severe dizziness, and difficulty breathing. If any of these symptoms occur after Narcan administration, medical attention should be sought immediately. It's important to note that the potential risks and adverse effects of Narcan are generally outweighed by its ability to reverse potentially fatal opioid overdoses. Medical professionals are trained to administer Narcan safely and monitor for any adverse effects. If you suspect an opioid overdose or need to use Narcan, it's important to seek medical assistance immediately to ensure the person's safety and well-being. That's a no for this video. If you want to watch more informative videos like this, please keep watching my channel. Disclaimer. Channel's intention is to make sure that its consumers get information that is accurate, reviewed by an expert and error-free. However, the information mentioned here should not be used as a replacement for the advice of a qualified physician. The information given here is for informational purposes only, which may not cover all possible precautions, side effects, contraindications or drug interactions. Consult your doctor and discuss your queries related to any medicine or disease. Thank you for watching the video. Don't forget to like and share. And please subscribe to my channel Medicine Guy.